Do you regularly suffer from headaches and migraines? If you do, then you're most likely one of the many individuals who are looking for a solution to their problem and looking for that to get out of pain as soon as possible. In this video, we're going to talk about things that you can do right now to help you deal with headaches, especially migraines. Now, neck pain is one of the most common migraine symptoms. Migraines and neck pain usually occur together, and this is true for regular headaches as well. Here's a fact. The source of the most common type of headache is not in the head. By the end of this video, you're going to find out one of the best natural drug-free approaches for migraine and headache relief. Let's go straight to the 8 top ways to relieve your headaches and migraines, and here they are. Number 1, practice stress management. Excessive stress is everybody's enemy. When a person is under stress, tension builds up in the shoulders and in the neck area. When this happens, it leads to the most common, most widespread type of headache, which is a tension headache. Reducing and managing your stress levels whenever possible is one of the best ways to prevent, or at least to minimize, the number of headaches that you have. Try to avoid negative stress coping mechanisms such as smoking, drinking, or drug use. Here's a list of common things that people do to prevent stress and actually create peace. Sometimes it's helpful to think in terms of opposites. I want to decrease darkness, but I also want to add light. I want to create peace, because of course creating peace automatically gets rid of the darkness, gets rid of the stress. Meditation, exercise, soaking in a hot bath, listening to soothing or energetic music, having a few relaxing hobbies, reading a good book or a positive source of information, talking to somebody who cares about you, therapy, including upper cervical chiropractic. Number 2, do some stretching. Here's the bottom line. The neck has an essential role in most headache and migraine attacks. For this reason alone, it's crucial that doing certain stretching exercises, especially in the neck area, can be so helpful in preventing not just neck pain, but also headaches. Doing regular stretching reduces the frequency of headaches and migraines. The most common and the most effective types of neck and shoulder exercises promote proper alignment of the neck. This practice helps because not only does it help to increase the range of motion in the neck and shoulders, but it also strengthens and stabilizes underlying problems. Number 3, have regular exercise. In general, exercise is a great antidote for neck pain, shoulder tension, headaches, and migraines. Exercise allows certain hormones to be released into your bloodstream that helps to alleviate pain. Suitable exercises include those that strengthen and promote blood flow in the head and neck areas, also your core and your spine. Number 4, use ice. Ice is a natural counterattack against inflammation for people who have had injuries to the head and neck area, such as sporting accidents or car accidents in which a whiplash type of injury is often sustained. When these injuries occur, it leads to chronic neck tension, headaches, and oftentimes migraines. Just grab a few ice cubes, put it inside of a face towel, and there you go, you have an ice pack. Use that ice pack, apply it to your head and neck area on and off for a few days right after an injury. This method is going to reduce the inflammation. Make sure the ice pack stays on the affected area and maybe even a little bit above the affected area to make sure the scar tissue and inflammation is flushing downward and away from the brainstem. You should do this for at least 15 minutes, but try not to do it any more than 20 minutes at a time. Number 5, make some lifestyle changes. Understand that some of your lifestyle choices may be causing or greatly contributing to your neck pain, shoulder tension, headaches, and migraine. So it's a good exercise to regularly examine your habits and then possibly adjust them accordingly. A few examples might be drinking alcohol, smoking cigarettes as mentioned earlier. If you continue doing these lifestyle habits, then it's interfering with the blood flow in your body, and that could be contributing to the headaches or to the migraines. Additionally, these bad habits lead to dehydration in the spine, and this can decrease the cushioning or the space between the vertebrae, and this means that there's less clearance for the nerve to get out to this area of the body. And then number 6, and finally, get upper cervical chiropractic. As mentioned earlier in this video, upper cervical based or upper neck based chiropractic is a very effective means of decreasing the tension in the neck and the shoulders area, and also helping naturally and drug free with headaches. What happens is, since the atlas and axis vertebrae, since their job is to protect the brainstem, when they're misaligned through different accidents and injuries, bumps and bruises over time, what happens is the vertebrae shift out of their normal position. They get locked into a stress position. You can still move, you can still get around, but the stress is always there. The tension builds. Oftentimes you'll have a shorter leg, a longer leg while you're lying down. Standing up, one hip can be higher, one hip can be lower than the other. There's a twisting of the body framework. The muscles are too tight on one side. There's more weight on one side of the body. It's a progressive degenerative condition, and it only gets worse because gravity isn't going away. Nerves are compromised, structures break down, and functions are limited. Now, the unique thing about the upper neck area is that Atlas, or the C1 vertebra from Greek mythology, was that titan that held the world on his shoulders. But if your head's not on straight, your body's going to compensate to sort of get you back on straight once again. And that's how you can have the ensuing imbalances in the rest of your spine. You can't walk around like this all day, so nature says we got to compensate to keep the eyes level and make sure that you have some sense of normal or equilibrium from which to function. But the consequence many times for migraine sufferers, for headache sufferers, is there's a lack of normal nerve flow and blood flow from brain to the rest of the body, and this congestion is what causes the chronic pain and the flare-ups in pain. But gently and specifically adjusting or correcting the cause and the misalignment. In fact, no more pressure than what I'm pressing on my iPad right here. Okay? If you know which key goes into the lock, you don't have to try to jam it in there. So it's very, very gentle, it's very, very specific, and that's what our patients love about our approach to helping headache and migraine sufferers